Hello, my name is Megan Filipowitz. I am a nursing student at Indiana State University. This is for my nursing course, Community Health, with my instructor, Dr. Lucky, and today I am talking about osteoporosis in postmenopausal women. So what are some objectives for today's PowerPoint? To determine who is at risk for osteoporosis, to define what osteoporosis is, to list the signs and symptoms of osteoporosis, to discover common risk factors for osteoporosis, list resources for more information about osteoporosis, determine treatment for osteoporosis, and educate on ways to decrease your risk. At this time, if you would please take the pretest now, it is listed in the link in the description. If you'll just go ahead and click on that and open it, take the 10-question test, and at the bottom will be the answers to review. This is just to get your knowledge before this presentation, and then you can review those questions again at the end. So what is osteoporosis? Osteoporosis is a bone disease that affects both men and women. However, this particular presentation is about postmenopausal women. Osteoporosis leads to brittle bones or holes in the bones, which can cause fractures or breaks in the bone with little or no impact happening. So even if you just fell down slightly, you could still be at risk for breaking a bone if you have osteoporosis. Osteoporosis is largely tied to calcium deficiency, which is a large nutrient that plays part in the creation and maintenance of bones. So what are some signs and symptoms of osteoporosis? There aren't many signs and symptoms, as osteoporosis is one of those known as a silent disease, where most signs and symptoms aren't evident until a bone breaks. However, there are a few signs and symptoms that it is important to keep mind of. One of those being height loss. If you have any changes in how tall you are, each time you go in to see the doctor, make sure you keep track of your height measurements. It is important to note changes in posture, pain in the lower back, and shortness of breath. So who is at risk for developing postmenopausal osteoporosis? Risk factors include lack of physical activity, history of use of hormonal birth control, age, estrogen replacement therapy, obesity, smoking, family history, and certain medications. Women over the age of 50 have the greatest risk of developing osteoporosis. This is because women undergo rapid bone loss in the first 10 years after entering menopause. Because menopause slows the production of estrogen, which is a hormone that protects against excessive bone loss, you are more likely to get excessive bone loss after estrogen decreases in the body. Ethnicity is also related to osteoporosis. Caucasians and Asian women are most likely to develop osteoporosis. Family history also plays a risk in developing osteoporosis. If your parents or grandparents have had any signs of osteoporosis, such as a fractured hip after a minor fall, you could be at a greater risk for developing this disease. Those who do not have an active lifestyle can also be at risk for developing osteoporosis because inactivity can lead to bones becoming brittle. Smoking cigarettes also increases the risk of fractures developing. So if you are smoking, it is important to talk to your provider about stopping in order to prevent developing osteoporosis. So what are some diagnostic tests that can help determine if you have osteoporosis? First off, we have a bone density scan, also known as a DEXA. This stands for Dual Energy X-ray Absorptiometry. These types of X-rays don't have very much radiation, and they determine how solid bones are of the spine, hips, and wrists. And women who are over the age of 65 should have this test done. Lab work may also be done after diagnosis of osteoporosis via the X-rays, as it can show low levels of calcium, which can indicate that the bones are becoming brittle, which can lead to a future fracture. CT scans or MRIs of the spine can also show more in-depth detail as to how much breakdown is going on within the bones and the likelihood of fracture happening. So what are some treatment options once diagnosed with osteoporosis? First of all, you may be put on a high-dose calcium supplement to help replenish the calcium lost within your bones. They may also recommend doing weight-bearing exercises to help increase bone and muscle strength. Hormone replacement therapy may also be started to introduce more estrogen into the body to help decrease the absorption of calcium into the bloodstream and not into the bone. Another type of medication is part of the hormone class known as a bisphosphonate. This is used to stop the body from reabsorbing bone tissue and calcium to help maintain the strength of the bones. So what are my resources? One of the resources I have listed is the American Bone Health website, which can be found at americanbonehealth.org. This can give you more information about the description of what osteoporosis is, how you can be tested for osteoporosis, what kind of treatments there are, and what kind of providers can be seen that are specialists in this field. Another website is the International Osteoporosis Foundation. This describes osteoporosis throughout several different countries and ethnicities and can share the differences between ethnicity likelihood of getting osteoporosis and treatment options that are specific for you. Lastly, I have listed the United States Bone and Joint Initiative at usbji.org. This website is very descriptive, that has discussion groups, programs, and meetings, and you can become a member as well as donate to help cure disorders of the bones and joints. This website will help you stay in contact with others who may have been diagnosed with osteoporosis to receive that community support. And this comes to the conclusion of my presentation. I want to thank you for following along with me, taking the test, and helping me present topics like this to the public. Here listed are the resources I use to find my information about postmenopausal osteoporosis, and hopefully this presentation has helped you learn a little bit about it. If you ever have any questions or concerns, you may always speak to your primary care provider about diagnosis or risk for osteoporosis. Thank you for watching.